20 years ago, consultations were often straightforward. Nowadays, consultations are much more complicated and complex because patients are living with more complex problems, often 2 or 3 or 4 conditions that they are now living well into their 80s and 90s with, and which we need to provide support and help with for each and every one of those conditions.
The profession as a pharmacist has developed vastly over the last 70 years. Before, we were known as dispensing chemists, where our role primarily focused on dispensing. But over the years, the focus has shifted from dispensing to providing patient-centred care and actually speaking to our patients and making sure we are able to provide the best possible services.
Pharmacists now have access to much higher education, which allows them to work alongside doctors to help them prescribe medicines and manage patients both in hospital and in the community and GP surgeries, where they couldn't do back in 1948.
I think nowadays for patients things are better in the service they get from optometrists because of the access to optometrists locally, and because of the equipment that optometrists have, and because of the training that optometrists get these days, and the way in which optometrists work closely with other health professionals such as the GP and the ophthalmologist. So this gives patients a really good level of care.
The big thing when you get a patient out of pain, they're so grateful for you for doing that, and that's a really nice thing. It's lovely doing dentistry, but when you get someone out of pain, or aesthetically, when you can help someone like myself, that you can go out and smile at the end of the day, that's a really nice thing.
Something I would like to say to a nurse in 1948 is thank you very much. If you weren't there, I wouldn't be here right now. The profession has changed so much, it's rapidly expanding. So as a first destination career, I'd 100% recommend practice nursing.